All right, so we are live with talking about prescriptions, and we're going to talk about how um, if your prescriptions are actually putting you further into burnout. I did ask a question earlier in my 911 stress management group about prescriptions that you guys were taking. And the reason that I was asking that is because with a lot of statistics that I have, there aren't a lot of statistics that are done solely on that are done solely on first responders. So in talking about burnout, when it comes to prescriptions, there's a lot of things that we need to cover. So taking into account that the stats that I'm going to go over with you are more for general population, but all of the side effects are the same. And we're going to then eventually dig at the end, we're going to dig into burnout and what all of those symptoms are. And you're going to be able to link a lot of the symptoms that go with quite a few medications that you're on. So I'm going to do a super quick check just to make sure that we are live in the group. Make sure there weren't any Facebook glitches. While I'm doing that, let me know in the comments when I'm going through this list of prescriptions, let me know which ones you might be taking, or that you know that other officers, other first responders are taking, so that I can really know which ones to be honing in on a little bit more now. So let me know that as we're going along. I just do want to start this, like, prescriptions, it's a huge business. And there's absolute upsides to it. So I want you to know, and I want to make it straight out before we get into this, that when I'm talking about prescriptions, I'm not saying that all prescriptions are bad. There's an absolute reason for many of them. They do definitely fix immediate crisis symptoms. I know EMS, you guys, there's no way that you'd be able to save as many people if you didn't have pharmaceuticals. We need them. They keep us longer, living longer. We need them for immediate relief. I've got a lot of notes I've written, guys, so I may be looking down sometimes. They help us with infections and crisis. They cure diseases. So I'm in no way saying that prescriptions are bad. It's just we do have to take into account of it, because there is a downside to prescriptions. And with that downside, is really that we quite often have to take a lot of meds for each individual symptom. And quite often when they're fixing one symptom, they may be causing other issues in our body. And sometimes the pros outweigh the cons, absolutely. And sometimes they don't. So I'm just here to give you the information today so that you can really understand about that. So getting into this first, we're going to go through a list of, as I mentioned at the beginning, these are typically for men and women that are not first responders, because I know that antidepressants and anxieties are super high for first responders, but for men, they're actually third on the list when it comes to general population. The first for men are usually hypertensive ones, so blood pressure, statins, so your cholesterol meds, antidepressants, anxieties. Then you get into insulin and glucose management. So that's your blood sugar management. We get into proton pump inhibitors, all of your stomach to stomach acids. Then aspirin, just regular old aspirin for aches, pains, all of those things, beta blockers, allergy pills, thyroids, allergy and asthma. When we're going into beta and agonists, hormones, we have your non-steroidal anti-inflammatories. For women, the top are antidepressants and anxiety. Thyroid, birth control is a big one. Allergy, asthma, antihistamines, antihypertensives, so your blood pressure ones as well. NSAIDs, your non-steroidal anti-inflammatories. There's a lot of inflammation going on. We have still proton pump inhibitors, allergies, and all of that. So we're going to go through today the list, and we're going to make sure that you guys understand how some of these things could actually be putting you further into burnout. When you're doing the job that you do, there are certain contraindications with some of these medicines that are already being really taxed in your body just because of the job, because of the long shifts, and always going to calls and always living in your stressed nervous system. All of these things do already put wear and tear on that some of these medications do as well. Now, with everything I'm going to be teaching you right now, I really need you to know that not in any way at all am I telling you to go off of any of your meds. In my program, whenever anybody gets to that point, it's their decision. We don't talk about it with them. We do ask them what were they on and what are they not on now in the program, just to see what they have got off. But all of that is to do with your doctor. You talk about that with your medical doctor. They go through it with you, and everything is through them. So make sure that you do consult a doctor before you make any changes in your medications. And the thing too is, not all medications are bad. So when I'm going through this, yes, some of these may be stressing your body and putting your body further into burnout, but some of these may be helping you get through every single day, and you would not be able to. I know in some situations too, some of the meds that I know one specifically in the program is on has stopped him from committing suicide. So in no way, shape, or form am I saying that these medicines are like always bad. Pharmaceuticals are always bad. Just understanding and weighing where you are and understanding if there are some ways that we can actually get your stress system supported and get your burnout so that some of these symptoms go away, that you don't need these medicines, okay? So I'm going to be going over some side effects with these medicines. And some of them are quite interesting. So before we get into that, let's just do a quick and dirty on your stress system. So your stress system consists of three different parts that I know that we work on in my program. One is your hormones. So your stress nervous system manages 50 different hormone responses: sleeping, waking, energy, moods, cognitive thinking, healing and inflammation is a big one that we're going to be talking about now. It regulates a lot of the, it regulates your cholesterol, your insulin levels, your glucose, all of these things. So your stress system is directly related to that. Then we have your nervous system, which we speak of a lot. Your nervous system, you're in your stress nervous system and your resting nervous system. Your nervous system takes a hit. Anybody who has PTSD, it shows that there is damage in your nervous system. And we do like a lot, months of working on regenerating and strengthening your nervous system that often gets affected with PTSD and with high end stress. So your nervous system plays a huge part in this as well. And then the third thing is your gut, your digestion. So stomach acids, constipation, diarrhea, nausea, vomiting, anything to do with your gut and digestion, highly ranked in your stress system. Your gut is responsible for 95% of the production of your serotonin. So serotonin is your happy, really good mood hormone. And so anybody that is on anti-anxiety meds, antidepressants, quite often they are synthetic serotonin that's going in. And so it's really important to understand that when I'm going into some of these side effects, because you might start seeing some of the links to other things that may be happening in your body. And then at the very end of this, I'm going to put it all together as to how we get people off of quite a few meds. Sorry, that's not the right terminology, because we don't get you off. That's all done with your medical doctor. What we do is we get your system strong enough that you can then go and have a talk with your medical doctor about which medications you can be on or decrease doses of. So getting into that, antihistamines, allergy meds. They actually can cause side effects is gastrointestinal issues. So if you're already struggling with gastrointestinal issues because the gut and the nervous system have a huge link in that with burnout, then antihistamines can be contributing to some of that. And the most interesting thing, which is why I thought that this was a really good one to be adding in here, is melatonin. So antihistamines, so your NSAIDs, your non-steroidal anti-inflammatory meds, and your allergy medications, they can actually deplete melatonin. And melatonin is your sleep hormone. So if you're struggling to be able to get into a sleep and stay in a sleep, and with melatonin, is when melatonin is released in your body to start your sleep, when a certain amount of it is released, it starts a whole cascade of healing of the other hormones that your stress system manages. So if you are depleting your melatonin even more, your shift work, 12-hour shifts, sleeping all different shifts and times already has stressed and damaged, not damaged because it can be fixed. It has stressed and taxed your melatonin and depleted it already, that if you are taking allergies and NSAIDs, antihistamines, then that can also be depleting it more. The thing though with allergies, hay fever, inflammation, quite often those are because your stress system, those hormones aren't working the way that they were supposed to, as well as your gut isn't digesting food the way that it should because your acids are off, diarrhea, constipation, your small intestine is damaged, and different things that are causing your body not to be able to repair itself, which causes your hay fever, skin issues, psoriasis, eczema. So a lot of those things are linked. So getting then into, I have a huge list here of different ones: antidepressants and anti-anxieties. Again, gastrointestinal. So it could be diarrhea or constipation. And I hear from so many, I mean, we have a whole lesson in the program on diarrhea and constipation, getting that sorted before we can even start working on healing the gut. It can have liver damage, nausea, vomiting. It can mess with your appetite, these anti-anxieties and depression medications, your nervous system. So it can start causing some dizziness and tremors in your nervous system. Your metabolism totally gets shot. So you start getting weight gain, which when you're in burnout as well, your metabolism is already struggling. That's one of your other hormones that your stress system manages. So if the meds are also affecting these hormones that your stress system is already taxed and faulting, then that is where a lot of that weight gain comes from, especially if it's around your middle. And no matter how well you eat and how well you exercise, it's not coming off. We had a guy in the program, he lost 20 pounds in the first 2 months of the program. Only the first 2 months, there's no nutrition. He did not change any nutrition. He did not change, he did not add workouts, nothing. He didn't do no working out, anything. It was because his stress system was able to get realigned, and his metabolic hormone was able to start doing what it needed to do. His glucose hormone was also able to start regulating his blood sugars, and his body was able to start using the food the way that it was supposed to be, and he started actually releasing the weight around his gut that it had been holding on to. It can affect, so anti-anxiety, depressants can affect your circulatory system, your cardiovascular system, your mental and emotional. Your anxiety can actually worsen. And so can the depression with some of these. As you guys know, I'm sure some of you who have been on these have been on different ones. Some work, some don't. You have to go through different changes to find out which ones work for you, because I just had a child that fell down the stairs, I think. 1 second. Okay, we are back. Sorry about that. My son fell down the stairs. He's okay. He needed more hug and cuddles, and that he'll be bruised, but he's okay. So my apologies. Life of being home in quarantine while you're trying to work. So just to backtrack a little bit of what we were doing is we were going through different prescriptions and the side effects that they had and how that relates to burnout. I need to recap. If you can, please go to the first video and go over that first, because I do need you to understand that we're not telling you to go off medications. We also do agree that there is 100% a need for medications and prescriptions, and we need them to be there, but it's a business. So we need to be understanding of really what they all pertain, and if they necessarily are the best option all of the time. Again, the decision is between you and your doctor. If you do want to make any choices in the prescriptions that you're taking, what I'm doing today is just teaching you about the side effects of some of these prescriptions and how they actually relate to burnout. Okay, so quick recap as well is that you have three stress systems that we're digging into, or sorry, three systems that make up your stress response. You have your hormones, you have a nervous system, and then we have your gut. Definitely go back and check out the other video first if you missed that. But we are going to start digging into where I left off last, which was, one second. Okay, we're all good. So where we left off is when I was talking about anti-anxiety and antidepressants and how they can affect your body. So we had already covered the gastrointestinal issues from the nervous system and your metabolism, circulatory, cardiovascular. We got into the mental, emotional aspect, and then hormonal. So for women who are on anti-anxiety or antidepressants, it can actually cause your cycles and your hormones to become abnormal, which makes sense because they are going in and they are changing some of your hormones, and these hormones are all connected. There's a pathway for your 50 different hormones as to how they flow down this path. I kind of describe it as a mountain. We have pregnenolone at the top, and then it splits into two different jobs, and they split. It doesn't completely keep splitting 4 and 8, but similar. So where your reproductive section is there, and that is very close to where your serotonin hormone, which is also in the pathways, it is there. So when certain hormones are getting boosts synthetically, then other hormones are also being affected indirectly. So it really does make a difference in when you are pumping any sort of a synthetic hormone into you, which quite often with the antidepressant, anti-anxieties, it is the serotonin. And as we said as well, if you're having gut issues, 95% of your serotonin is actually produced in your gut. So if you're on proton pump inhibitors, you have diarrhea, constipation, you can't digest food, the odds are that your body is not getting the amount of serotonin that it needs naturally, which is quite often why a lot of you do end up on anti-anxiety and antidepressant medication, is because your body isn't giving you the serotonin that it needs. So that's where we definitely dig deep into the gut in my 911 Elite Performance Program. But we can't do it at start because your nervous system is, if it's firing and firing like crazy, if you're always in that stress system, it actually slows down your gut. So if we were to go in and start fixing your gut and not doing anything with your nervous system, then your gut would never fully fix because it keeps being shut off and turned down. So you just keep taking like one step forward, almost 2 steps back when you're trying to heal that gut. So really taking into account all of the different parts of your stress system in order to heal things so that your body can start producing what your body needs. And then that gets us to, we have muscle and joint pains can come from them. And this one also depletes your melatonin. So we were talking about that with antihistamines and non-steroidal anti-inflammatory drugs. Those also deplete your melatonin. And so this causes more insomnia. And the thing is that most of you are already experiencing insomnia because there's a huge, the glucose and your cortisol hormones that your stress management system is in charge of is already a disaster, from 12-hour, 24-hour shifts, OT, days, nights, switching all over the place, and from rushing to calls all of the time, being in that stressed state for so long, your hormones are all out of whack for that your cortisol is quite often already high and your melatonin doesn't know when to be releasing. So your melatonin gets more depleted. So if you're adding in antihistamines, anti-inflammatories, you're adding in anxiety and depressants, then it could also then start getting you to struggle to be sleeping more, which then brings in where you actually start taking sleeping pills. And those have side effects too that start just becoming this whole revolving circle. So sometimes 100% these medications are needed, but if we can actually dig to the root of the problem, sometimes we can get it to where, at least we do in my program, to where those go to their doctor and their doctor is able to get them off of them. Okay, antihypertensives. So your anti-stress, your blood pressure medications, and that same thing, gastrointestinal issues. That one is more upset stomach, diarrhea. It's rare that it is constipation. And nausea, vomiting, hepatitis, jaundice, dizziness. It gets your nervous system. It throws off your metabolism again. So you can get hypoglycemic. So many of you as well get hangry. You get those blood sugar lows, which is quite often when you're going into that stress system all the time, always pushing out that stress. Then with that, your body is always sending out that glucose, which throws off your metabolism, throws off your insulin, your blood sugar levels, all those things. And then on top of it, if you are taking these medications as well, it can add to that. Circulatory issues. So it can actually cause some other circulatory issues being on them. It can also cause depression. So it's like you could be on both the hypertension and the depression, and one could also have the symptoms of the other. And then we've got muscle pains, back pain, and that gets us next into, where are we going to get to? The next one, so I'm just scrolling down. I had so many on my list here. I'm just going to go through different ones that, okay, we've talked about the melatonin with NSAIDs, with the non-steroidal anti-inflammatories, but I know a lot of people are on different kinds of anti-inflammatories. These can be like Advil, just your over-the-counter meds. They can cause constipation, abdominal discomfort, nausea, diarrhea, peptic ulcerations. They can cause issues with your stomach acids. They get you burping, or where you really always feel like you need to go to the bathroom. So a lot of different digestive issues can happen from that. And as we were talking about, your gut plays a huge part. They have 95% of the serotonin, but you also, many different hormones that your stress system manages relies on your gut and your bloodstream to be able to get those out into your system. So if that's not working well, then it's just adding more strain to the burnout. It can get your nervous system off, where you can actually get impaired concentration. Messes up your metabolism again, which we already talked about. Whenever you're sending out, with your glucose being sent out for every stress, that starts throwing off your metabolism, and the fact that the melatonin's not releasing and getting your metabolic hormone starts getting totally thrown off. And if you're going to be taking certain medications as well, where you may require them on a regular basis, because when these hormones, your body can't heal, the inflammation system isn't working, your inflammatory hormone can't heal things, which is causing your joints to hurt, causing pains to happen, causing injuries to happen more frequently, more micro tears in your muscles. And you get to where you get to where you start having more injuries. And but then we need the anti-inflammatories to help mask the pain. But so it's not fixing the root of the problem. It actually could be adding more fuel to the fire. Okay, so it gets into as well circulatory issues, mental, emotional, musculoskeletal, and it can deplete your folic acid, which is important for anybody who's pregnant. And it also puts you at a risk of certain cancers. Okay, we're going to get into cholesterol meds. So cholesterol, the statins for lowering your cholesterol. This one I found very interesting because with this one, with active people, your soft tissue, it actually can have muscle damage occurring. Okay. And that's really important to know because for you guys are active your whole shift. You need to physically be pushing your body. Okay. So it can be causing gastrointestinal issues. It can be causing diarrhea, constipation, acid issues, vomiting, all kinds of liver issues. So it's really important that if you're already having these issues because of stress, because of being in burnout, that the cholesterol meds could be adding to that. Nervous system, you could be getting headaches, dizziness, insomnia, drowsiness and fatigue from your nervous system, from statins, from your cholesterol meds, memory loss, decline in your cognitive function. Now, these are things that we talk about all the time, the brain fog that hits you guys. This is so common in many of you first responders, and it's to do with a lot of the with always being in your stress system, with lack of sleep, with the different hormones that your stress system manages, that help you with your cognitive thinking. When you're in your stress system, you're narrow-minded, can't big picture think and see things and take things in and remember them the same. So there's a lot of different factors that come with burnout, and then these also kick in with cholesterol meds. We have circulatory, cardiovascular issues that can come up. High blood pressure can come up from cholesterol meds. And then you get mental, emotional. It can cause depression and anxiety, impaired cognition, decreased libido. So you may need to be on like Viagra and cholesterol meds to be able to battling both problems, right? It can actually do increase suicidal thoughts as well with cholesterol meds. So the thing to understand is that is one of the hormones. One of your hormones is what manages the cholesterol in your body. It's what gets everything going that your stress system manages. So when your stress system is off, it can throw your, it can totally throw your cholesterol off. Okay. So a lot of these things, it's possible. I am not diagnosing, but it is very possible that through stress, through burnout, through your hormones, through your nervous system, and through your gut, that you're experiencing all of these symptoms. And we go to our doctor and we usually just talk about one thing at a time. Like, hey, doc, I'm not digesting meat anymore. I can't eat fats, or I can't sleep anymore, or I'm always worrying and I'm anxious, right? I have no motivation and drive. I'm always exhausted. You usually go with like one symptom, and usually they treat that one symptom with one medication. But if we actually stop and look at all of the symptoms that you're having and we put them all together and we actually fix the root cause, then we can actually help so that you don't need to be on either any of these medications, or you only need to be on the ones that your body specifically needs because you're specifically having those issues in your body that it really does need. But if we can fix the root cause, I mean, hell, why not, right? So let's go into this one's a big one with, I know with a lot of you guys, is your proton pump inhibitors. Okay, so quite often it's for GERD, it's for people where we make an assumption that you have high stomach acid, but I'm going to bet that most of you actually have low stomach acid. Don't think we've had one person in the program, one that I know of, that tested normal for stomach acids. They didn't test high. I have one that tested normal. Every single other person, when we do the testing for your stomach acids, test low, like almost non-existent low, which is where you can't be digesting meats. You may have been able to have eaten like a huge steak, and now you struggle to have a steak or anything fatty or fried. Your body can't handle anymore. You may have where vegetables just go right through you. And a lot of these things are because of not having all of the stomach acids that your body needs. And then you get further damage to your small intestine, and you get the diarrhea and the constipation, and it just becomes this whole whammy of stuff that causes this. And quite often the doctor or we self-diagnose, and we start taking antacids, and we start taking proton pump inhibitors. We had a guy that when he was 17 years old went on proton pump inhibitors, and he's off of them now, totally off. I actually don't know his age. I'm going to guess he's in his mid to late 30s. And he's off of all of his meds. He was on some anxiety, depressant meds and everything, off of all of them. So it's really important to be looking at the other factors of your job and things that do come into that. But let's dig into these proton pump inhibitors. So it does causes more bowel irregularities, and it can aggravate constipation even more. It can make it so you have trouble swallowing. You start getting problems in your stomach lining. Get more burping coming up. You can get ulcerative stomach, stomach ulcers, nausea, vomiting. You can get colitis, pancreatitis, abnormal liver functions, increased liver enzymes, hepatitis, jaundice. Like there's so many different things. You can get bilirubin in your blood. So there's a lot of different gastrointestinal issues that can happen when you're taking the proton pump inhibitors. And it's quite often, at least from what I'm seeing in my program, is that people are taking them assuming that they have too high of acids when they actually have too low. So they're not even fixing the problem. They can also cause nervous system issues, confusion, dizziness, insomnia, migraines, that pins and needles sensation in your body, sleeping disorders. Not like you guys don't have enough of that as it is without adding that to it, right? Metabolism, again, can get totally thrown out the window. Circulatory, cardiovascular issues, hormone issues. You can start getting muscle spasms. So if you are, and you know what, speaking of that, the gentleman too that was on proton pump inhibitors was always getting leg spasms when he was sleeping. So a lot of these things are really, really connected. Cramps, hernias, all of these things, back pain, muscle pain, bone fractures, these are all related with proton pump inhibitors. And then you can also be depleted in vitamin B12 and vitamin D, calcium, iron, zinc. Now, that's very important to know, because if you can get depleted in them, vitamin B is a huge stress support for your system. And so is D. And there's a lot of studies shown that those who work night shift are already very depleted in D. So if you're taking something that's already depleting them more, then that can make a big difference. Then we get iron with energies. And zinc is another one that keeps you healthy, but it is also a huge support for your stress system. And zinc also does help your digestive system as well. And depleting your protein. All right. I don't think I need to go any further into that. I think that you guys get where I'm getting with all of this, is that it really is important to understand, though, that pharmaceuticals are a business. They are. There's a lot of pressure for doctors to be prescribing. It's also a lot easier for your doctor when you go in with only one issue to fix that issue and give you a pill for it. And then to really sit there and go through a lot of time with them where where you really have to be working on habits and making lifestyle changes, because it's much easier to take a pill than to change some things in your lifestyle. And the thing as well is, for your life and as a first responder, is the things that you require in order to support your stress system is very different from civilians. So different. And most doctors, most people don't understand that. So they start giving you tips and tricks and things that actually don't work. Start eating healthier and start working out more, where the working out more might actually be causing more issues than not at the beginning. The goal is to get you where you're in like elite shape and you can kick butt in any workout. But in the beginning, depending on where your stress system is, that may not even be the best advice for them to be giving you. It's case by case. So it's so important for you to know that we can dig into the root cause. But like my program is 12 months. It takes 12 months to get your hormones, get your nervous system, and get your gut back on track. You start feeling better in the first month. You start sleeping better in the first month. You get more anxiety, you get more energy, and you decrease the anxiety. Your motivation and drive increases in the first month. But if you're not going to put the work and effort into the rest of the 11 months in order to make sure that the hormones, the nervous system, and the gut are totally aligned and totally put into place the way that they need to be, then that is what your doctor is fighting, and that is why they're giving you the pill. Okay. So it's really important to understand that it does take work, it does take effort, it does take consistency, but it doesn't have to be overwhelming and it doesn't have to take a lot of time. The lessons that I send out are 10, 15 minutes, 3 to 5 times a week over the 12 months. And most of the guys do it in the bathroom. I know my husband does. Every morning in the bathroom, that's what he reads as his lesson of the program. And a lot of the guys in the program do that. So it is more consistency and giving yourself that time. And if it is that time in the bathroom, that is what it is. Okay. Reach out when you have questions. Let me know. If you want, I do have a bigger list of all the contraindications and different things that can be popping up for a lot of other meds. So if there's anything that you want, just comment and I can get that to you. But if you would really like to work on getting off of as many of your medications as you can with your doctor's help, with your doctor's consent, sorry, be my help, his consent, then definitely reach out. Okay. You can private message me. You can comment on this post, or you can email me. It's support@911lifestyle.com. All right. Take care, everybody. Be safe. And just know that I've got your back.